Hello. Miss Wright. Thank you. Yes. Place your name in your campus in the chat box. We'll actually go ahead and get started in about 2 minutes. This PowerPoint and this recording will be shared. So we'll give it about 2 more minutes. It's 6:01. It was set to start at 6 o'clock, but we will go ahead and get started in about 2 minutes. Miss Wright, you doing okay this evening?
I am, yes, thank you. How are you?
Doing well, doing well. I know some had clinical, but I guess they may come in a little late, but no fear. We'll go ahead and start in 1 minute. We'll do
Take your time.
everyone's time. And the review recording will be shared also.
Okay.
If you all like, I can share this PowerPoint as well.
That'd be great, thank you.
Okay, it is 6:03, so we'll go ahead and get started. And slideshow from the beginning. This is exam review for exam 3, which will take place on next week. So these are some key concepts that I'm covering and just narrowing it down for you. We've had, a lot of chapters, a lot of content. So just kind of narrowing your focus down for this next exam. Of course, you all have been given a study guide. The chapters the unit exam will cover will be chapters 6, 7, 8, 5, 6, and 7, chapters 11 through 19, and chapter 28. So there are several chapters that will be covered on this exam. There are 50 questions. The questions will consist of multiple choice, selects all that apply, in math problems. There will be 75 minutes allotted for the time of the exam. General questions to review our IV calculations for math, determining equivalence and converting between the systems of measurements, oral and parenteral medications, medication dosages for children, review math handouts, and do practice questions. And also look at the levels of prevention in Healthy People 2030 objectives that are in each chapter. Again, this review is just to narrow down your focus. So the first concept that we will talk about is a national response framework. It provides the guidance in how the nation responds to all different types of disasters and emergencies. When a federal emergency has been declared, that's what they usually run across the TV, or you hear on the radio, there's been an emergency declared. So when that happens, certain things, the federal government, different governments, they sit into place certain things. And their focus is on transportation, temporary housing, medical resources, search and rescue, and firefighting. Just think about those things that are just most pressing when a disaster happens. Life, limb, eyesight. Those are those things. Go back to Maslow's hierarchy of needs: shelter, water. Consider those things. So that is their focus. So the National Response Framework provides guidance in how the nation responds to disasters when there are emergencies. Okay, data sources for community assessments. As the community health nurse, you will have to do an assessment, a head-to-toe assessment. Your patient will be the community. So things that you want to consider to gather your information are the dimensions of the place. This will be measured by data sources, that comes from maps, newspapers, local housing offices. You want to consider your people. So where will you get information about your people? The census, civic groups, church. Just think about all those data sources in which you will get information from and about your people. And then the function is libraries, police stations, welfare agencies, state departments, and so forth. So I put this little image here just to kind of help you, put it all together. So the dimensions of a place, people or persons or functions. Just remember that. So when we are completing a community assessment, hold on here, let me go back. Skip one of my slides. So we want to consider access to healthcare. It didn't skip my slide, but some of my information is not on here. But when we're trying to coordinate resources for our patients or our community, we need to consider access. Resources can be available, but how is the person going to get to that resource? How is that resource going to get to that person? How will they be able to use that resource? So we want to consider, our population first. Is our population homeless? Is the population, do they live in rural areas? Because we have to think differently about, or more broader, when we're trying to think about access to those resources. So social services will help us in fine-tuning or narrowing down those resources. They will help us to formulate a list of resources that are available. For example, if someone is homeless, they may not be able to, get to and from. Also, if someone lives in a rural area, transportation might be a barrier. Also getting to and from those resources. So social services, they have a plethora of resources that are available, and how, the when, the what, and how those resources can be used and utilized by the different populations. So completing a community assessment, you want to include all of these factors when you're trying to complete a community assessment: the politics, education, the recreations, the economics, and the religion, because we have to think about that, the whole community, not just one aspect of it. So make sure that you consider all of these aspects. Go back. I'm gonna come back to that slide. I tried to add these little, make it fancy, put some designs on it. I think I lost some of my stuff. Okay. All right. So when we are thinking about partnerships with the community, we need to think of it in realms of active and passive. Active partnerships, community partnerships focus on active participation by the community leaders, the businesses, and the organizations. These are the people and the persons and the businesses and organizations that will help us develop our programs, because many times they have the resources and the tools that we can use, or that our population or our patients will use. These programs have a larger goal of collaboration. They always have that piece of collaboration in helping out the community. So some will act in an active way, and some will act in a passive way. So an example of an active partnership is a business that provides low-cost snacks to an after-school program. And so that's how those businesses would collaborate and establish those partnerships with the local schools or local churches, and they have that extension so that the school can't provide the after-school program, because the school has a space, but then they may have a challenge of providing, a snack or some type of thing or food for the students to eat. And so they will reach out to the businesses and say, hey, we're having this after school program. Would you be able to provide a space, or would you like to provide, the snacks? And if they're being active, if they're actually providing the snacks. A passive partnership is creating a new park, a hospital providing a vaccination clinic, a recreational center offering cooking sessions. So it is like the passive partnership is a more broader and impacting more people. Because specifically the active, they're specifically on that set of students. But for creating a new park, that's for the entire community. That's a whole different population. So be sure to assess the community boundaries. The key in this right here, I added this image because there's a highlighter. This person is not going to step outside of the boundary. So when you're going into the community, you want to make sure it is key that you assess and understand the boundaries of the community. And that will help you move on to the other part of your assessments and gathering that data and establishing that rapport. So the key concept here is understanding the community boundaries. And we talked about several disease processes. One here is smallpox. It occurred thousands of years ago, and it is a result. It's also caused by the variola virus. And we talked about bioterrorism. So this is something that an agent that could be used for a bioterrorism act. And so think about, well, how, if that was to occur, how could we, the nurse, or what should we expect to an intervention to be? Well, a vaccination, because thanks to the success of the vaccination, the last natural outbreak of the smallpox in the United States was in 1949. So really, smallpox is really considered to be eradicated. So if there was a bioterrorism act that involves smallpox, we would think that someone that has been exposed to smallpox to soon be able to administer vaccinations. And they do have these vaccinations in stockpiles. So they're thinking ahead of, you don't want to say that they're thinking of doom and gloom, but they are just thinking of, things that could possibly happen. And what should our response be? First, second, and third. So immediately those that have been exposed, you will quickly want to get them vaccinated. During the community assessment, we're going back to this community assessment, the nurse will perform data gathering versus data generation. So we want to talk about these two concepts. Data generation is a process of identifying data that does not exist, but is developed through the interaction with the community. So you will, once you interact with the community, whether it be attending some of the functions that they're having, a local bike ride, a local walk on the courthouse square, and just interacting with the community, you will understand the community's values and what they believe and their social norms. So that is for data generation. You want to make sure that you understand about those social norms. Data gathering is the process of collecting information that already exists. So age of residence, this is information that you could readily, it may be it is documented, racial distribution, and then health organizations. This image here was supposed to be on another slide. Like I said, when I added the designs, it kind of moved some of my things around. So I'm going to actually pull that slide out. So the nursing process, can't get away from it. It functions as a systematic guide to client-centered care with sequential steps. So we know we have assessment, diagnosis, planning, implementation, and evaluation. So this slide focuses on the assessment piece. The nurse would advocate for the person so that they will have more control in decision making. So how would we do that? Assessment is that first step. It involves critical thinking skills. You want to collect as much data as you can. So that would be subjective and objective data. You want to have those conversations so that information is exchanged. You want to establish rapport so that person feels comfortable with you and giving you the information so that you can make a good assessment and can come up with those things that you need to advocate for that person. So skilled nursing care is the medical care or treatment that a patient needs. Only a licensed nurse or other healthcare expert can provide this care and treatment. So when a person gets ready to be discharged back into the community, you will have to consider, well, hey, which environment does this patient need to go to? Do they need to go to a skilled nursing care facility? And we'll talk about on another slide, or do they need that transitional care? But if they need the skilled nursing care, the person would need a licensed nurse or either some other healthcare expert to provide that care. And more families are opting for more stable and dedicated care for their senior loved ones. Home healthcare agencies are responding by offering skilled services rendered by licensed nurses. If a doctor prescribes, write a prescription for that respite care, then Medicare actually covers it. So tracing method, this is a method, mostly the hospitals, Joint Commission comes in. But anyways, tracing method is a measure of the process and the outcomes of care. So Joint Commission goes into the hospitals. In the long-term care facilities, the State Department actually comes in. It just depends on if that facility is considered a nursing home, an assisted living facility. But in in reference to this method right here, the tracing method, groups of clients are selected to evaluate the differences in outcomes resulting from the nursing care standards. So when you're using the tracing method, you have to ensure that the clients all have the same disease, the same stage of the illness, similar lifestyles, their intervention is similar, and they live in the same community. Otherwise, when you're measuring those outcomes, you will not get true results. So if you're using the tracing method to decide whether or not your outcomes are effective, you want to make sure that you are comparing oranges to oranges, so to speak. So you want to make sure the client has the same disease and also in the same stage of that disease, similar lifestyle, similar intervention, and then they live in the same community. So the tracing method is a popular method that is used. Quality improvement programs, they are used in pretty much all settings now, not just healthcare. But quality improvement is a systematic, formal approach to the analysis of practice, performance, and efforts to improve performance. So it has 3 phases. The first phase is the structure phase. During this phase, a nurse will determine if the philosophy or objectives align with the job description. You want to clarify the job description. Make sure, hey, these are the things with this person we're expecting this person to do. The second phase is the process phase. The nurse will evaluate the quality of care by reviewing nursing care procedures and identifying professional procedures. And then the third phase is the outcome phase. The nurse will evaluate the results of the QI by monitoring client safety and then measuring those health indicators. So make sure you know the different phases and which is the focus of each phase. The first phase, you want to clarify the job descriptions. So we can't get away from these different levels of prevention. So I included this slide. Primary prevention aims to prevent disease or injury before it ever occurs. Primary prevention interventions to prevent violence, because we know we had content on violence. So I added some interventions that are primary, just trying to get you to think outside the box. We know that we're providing that education. That's the education piece. So some examples of primary prevention to prevent violence are creating those protective environments, promoting social norms that protect against violence, healthy relationship skills. You're providing education about all of these. And they include one or more of the strategies to teach healthy relationships, promote those social norms that protect against violence, and create protective environments. And you want to provide information about warning signs for or consequences of intimate partner and sexual violence. So these are examples of primary prevention. So these are just some definitions of feminist ethics, virtue ethics, and caring ethics. Feminist ethics advocates for economic, social, and political equity and rejects abstract rules and principles, those gray areas. Virtue ethics seeks to enable people to flourish as human beings. And then caring ethics is based on the morality of relationships. So just be sure that you know the definition of these terms. So the teach back method, that is a method that we use to ensure that the things that we have taught have the person or the community has really understood, that they have learned whatever it is that you're teaching, that they understand what has been taught. And your focus should be on how do you know? How are you going to evaluate whether or not that your teaching was effective? So you want the client to restate or even demonstrate what you actually taught them. When teaching a skill, the nurse should have the client perform the skill to evaluate if learning was actually effective. You know, if you're teaching them about a dressing change, you know, step 1 is this, step 2 is this, and, you know, they're sitting there nodding their head. And once you finish, well, hey, you know, you may have a mannequin or a mannequin leg or arm say, hey, I want you to demonstrate what would you do. These are the supplies. Colostomy care, someone has a new colostomy. You will go through those. You may even show videos. You will actually demonstrate for them. Then you will want them to demonstrate for you. So that teach back method, you're having that client to restate or demonstrate. When teaching about managing a chronic illness to prevent or manage a crisis. So these are things too you want them to be cognizant of. The client should be able to, again, as I state, that they recognize symptoms of the disease process and then the appropriate actions to take if the symptoms occur. So you as a nurse will have to coordinate care when someone is being discharged. And so there are so many things to consider. Now, all of these things might not need to be considered in all discharges, but you might. So some examples that I placed up there, it just depends on the disease process. So if a person has congestive heart failure, you might want to consider coordinating that, and they're going home for home health. They may have to coordinate getting that concentrator in the home, you know, that local health store, or sometimes the local drug stores like the Walgreens, they have that equipment that people can rent or even purchase, but you would have to coordinate that for them. If the person has high blood pressure, they may need a blood pressure monitor. The person, if they have diabetes, you may have to coordinate getting that glucometer for them. You may even have to coordinate transportation if they have follow-up appointments, and in the event that they don't have their own transportation. Tertiary prevention consists of rehab and efforts to prevent disease progression after an injury or event has occurred. Our focus is on the outcome of a quality improvement project that decreases the incidence of a disease or improves the quality of life. So we have a disease process or an injury that has already occurred. So we want to maintain or improve that quality of life. And some examples are, you know, after a stroke, that person having that physical therapy in the form of rehab. And then sometimes you have to institute these interventions over time. So you may have to track the community incidence of complications from a vaccine preventable disease. So this other example, a community has, there's a disease process that has shown a, the increase in numbers in that community. And so over time, you may have to track something. So interventions could be like right now, or they can be over time. So you may have to track something. But with tertiary, we know that a disease process has already occurred or injury has already occurred. Quality improvement programs are critical because they drive improved outcomes for patients, improve efficiency of staff, and there's less waste. Programs should focus on ensuring the staff are aware of the customer service. You may want to implement a patient-client satisfaction program for staff awareness. And for the most part, I know the hospitals, for the most part, and the long-term care facilities, they have those quality improvement nurses. They call them the QA nurses. And one of their things is they talk to the patients and they ask about, hey, did your nurse, when they came in the room, did they have on their name tag? Did they wash their hands? And they may have where that same nurse might be over supplies ordering. And so they know that you have to keep up the number of dressing changes that you do have. Well, why do we use up so many supplies? We've only had 2 dressing changes, but the amount of supplies that we've used up, it seems like we had 10 dressing changes. So you may have to provide that re-education for the staff on that demonstration for them, that return demonstration, so that they can demonstrate for you that how to do that dressing change. Are there any questions about these key concepts? I've tried to narrow down, we had a lot of content, so I just tried to narrow down your focus on the, for this exam. I can share this PowerPoint if you like. Are there any questions? Be sure to place your name and your campus in the chat. These sessions are recorded. The video is shared, and also the chat is shared. So just so that, if something comes up about attendance, make sure you put your name and your campus in the chat. Right now, I can share this PowerPoint with you. The video will be shared, but if you like the PowerPoint, I can just post it in the classroom. Are there any questions about anything? Okay, so you have your study guide. Everybody did you receive your study guide?
Yes, ma'am.
Okay. And so those study guides, it narrows, it really does. It really do narrow down the information for you. I would have advised attending, if not attending, at least looking at the review sessions from the other professors, because everybody learns differently and we share information in a different way. And just because you hear it more than one time, that repetitive is automatically going to help you, that concept remain in your knowledge base. So if you all don't have any other questions, this is the end of the review session.
All right, thank you.
Thank you very much.
You're welcome. Have a good evening.
You too.
You too.
Bye-bye.